During her pregnancy, this mom admired a two-faced doll. When giving birth, she was shocked. An Australian woman has miraculously given birth to conjoined twins with one body and two heads despite doctors initially telling them to terminate the pregnancy. Renee Young and her partner Simon Howie, of Tregear in Sydney's West, welcomed their daughters on Thursday 6 weeks before they were due. The couple, who found out via an ultrasound that the twins they were expecting was in fact one child with two symmetrical faces and two brains connected by the one brain stem, said doctors were shocked by the girls' exceptional progress. Two girls in one body, Renee Young with her daughters Faith and Hope, who were born in a Sydney hospital on May 8. Faith and Hope were born with a rare condition called diprosopis, which means they share the same body and organs but have separate brains and two faces. Proud mother, Faith and Hope are now in a stable condition and breathing without support, after initial doubts. They are breathing perfectly on their own and feeding, Mr. Howie told Woman's Day. Ms. Young gave birth to the girls, named Faith and Hope, via an emergency cesarean at Blacktown Hospital last Thursday. The girls were born with a rare condition called diprosopis, which means they share the same body and vital organs but have their own faces and brains which are connected by only one brain stem. Even though there is only one body, we call them our twins. To us, they are our girls and we love them, Mr. Howie said. They were transferred to the Children's Hospital at Westmead shortly after they were born. We have no idea how long they will be in hospital. We just want to bring them home, happy and healthy, to make our family a little bit bigger and a bit more chaotic, Mr. Howie said. Hope and Faith have their own brains which are connected by only one brain stem. I think they're beautiful and Simon thinks they're beautiful, so really that's all that matters, their mother said. As the parents of 7 other children, Renee and her husband Simon Howie never considered terminating while the girls grew healthy. The condition is so rare that only 35 cases have ever been recorded and none have survived. Due to the incredibly complex nature of their condition, doctors are so unsure about what to expect from the twins' condition that they are being forced to make their prognosis day by day. Mr. Howie confirmed that specialists are being called in to decipher a range of problems and assess the twins in great depth, from the functioning of their lungs and blood vessels to decisions about how best to proceed with feeding. But despite all the forewarned medial problems likely to come their way, Ms. Young and Mr. Howie are just happy their girls are alive and well. I think they're beautiful and Simon thinks they're beautiful, so really that's all that matters, Ms. Young told A Current Affair. Mr. Howie said, I sort of don't believe in terminating the baby if it's healthy and growing fine and everything is going to plan. Their mother Renee gave birth to the girls via an emergency cesarean. Their condition is so rare that only 35 cases have ever been recorded and none have survived. From as early as 28 weeks into Ms. Young's pregnancy, specialists were concerned about grave developmental issues. One of the biggest predicted survival risks from their doctor Greg Kesby was that the babies would be unable to breathe on their own. The couple, who are parents to 7 other children, were also told early on in the pregnancy not to keep the child because it would be looked upon by the public as a freak. They defied the doctors because Ms. Young had never terminated a pregnancy and because they had a family that gives us a lot of support. At first, things certainly looked to be taking a turn for the worst as Ms. Young unexpectedly went into labor at only 32 weeks last Thursday and was forced to have an emergency cesarean. The couple refused to terminate their unborn twins despite being warned by doctors of the medical and social problems the girls were likely to suffer. Channel 9 were given the honor of choosing the middle names of the newborns, picking Daisy for Faith and Alice for Hope. The twin girls were not breathing in the first few moments after their birth, leaving their parents in a state of great anxiety. But despite problems from the first moments of their birth, in which Faith and Hope were not heard to be breathing despite having a clear singular heartbeat, the girls have now defied all odds and are currently in a stable state and breathing without any assistance. Although the couple were aware from the early stages of pregnancy that their children would have great developmental problems, they explained that while the girls continued to grow healthily, they couldn't come to terms with letting their unborn twins go. We sort of looked at it as, it'd be the same as being a child with autism or Down syndrome. I sort of don't believe in terminating the baby if it's healthy and growing fine and everything is going to plan, Mr. Howie said. The proud parents of the small survivors have braced themselves for a difficult path ahead and refused to say goodbye prematurely. I would say, if I only get 2 days with the baby, I only get 2 days with the baby, at least I have some time with it, Ms. Young said. The conjoined twins share all their major organs apart from their brains. It was at 19 weeks into her pregnancy that Ms. Young became aware that her unborn babies were conjoined. Diprosopis condition medical facts. The rare condition diprosopis is also known as craniofacial duplication. Diprosopis refers to a baby born with a single torso, normal limbs, and facial features, which are duplicated to a degree. In mild instances, the baby may have a duplicated nose and the eyes may be spaced far apart. But in extreme cases, the entire face can be replicated, hence the name diprosopis, Greek for two-faced. Most babies born with diprosopis are stillborn, and there are fewer than 50 cases documented since 1864. Where a baby is born with two complete identical faces, the condition is considered a rare variant of conjoined twinning. But while conjoined twinning is the result of an incomplete separation of two embryos, diprosopis is caused by abnormal activity of the protein sonic hedgehog, SHH. The protein is responsible for signaling craniofacial patterning during embryonic development, and among other things governs the width of facial features. Where the protein is found in excess, a baby will have wider facial features, and in extreme cases it can cause the duplication of those features. Diprosopis can be detected via ultrasound in pregnancy, or via CT scanning. One of the first indications of the condition is the detection of an abnormally high amount of amniotic fluid present within the amniotic sac. There is currently no treatment to cure the condition, and because of its rarity few treatment options or corrective surgery techniques exist.